What we are seeing now is that patients with chronic disease like cancers, patients with chronic HIV end stage, patients with all kinds of illnesses at their end stage, the care for them has definitely, this is attributed to a better understanding on the use of analgesia, drugs like morphine, which most of the times most doctors, I must say, unfortunately, also fear to use. But we can see, we've already seen a change in that, and we're seeing more doctors now being more confident in using that.
In Sekoma Memorial Hospital, we have a great team that we're working with. We have our Friday palliative clinic, and during this day, we book for our patients and their families, because our contention is that our patients should receive support from their family members. So we gather together with our patients, their family members, and our members of staff. Now, our palliative care team consists of a social worker, a dietitian, an occupational therapist, a physiotherapist, our doctor, the oncologist, and his wonderful nurses. We gather together as different professionals to assist these people, because we believe that these people should receive comprehensive care. That is why we want to.
I'm Mr. Makhala, working oncologist in Koma. Before I went in oncology, I was working in Francistown, ICU, and from ICU I went to Young Medical. So in oncology in Sakoma, I'm working as a principal registered nurse. So most of the time, my main role is to advocate for the patient. Most of the time I'm with the cancer patient. I try to identify their needs and contact the doctor, the oncologist, and anybody who is in our team, like dietitian, right, physiotherapist, and others. So in oncology department, by giving the chemotherapy, I'm assisting the oncologist to give the chemotherapies. I assist with putting the IV lines, giving pre-medication for chemotherapy, and monitoring the patient in chemotherapy. So that's basically what I do. And we have a palliative clinic which runs on Fridays every Friday after 3 weeks. Then in our palliative clinic, identify the patient who needs palliative care. So in our palliative session, we have a social worker, a dietitian, nurses, the oncologist, and the pastor. So everybody, every specialty is on board on how they help the patient.
Hello, I'm Sheikhala Batse, one of the nurses working here in Sakoma Memorial Hospital Oncology Department. We do have a palliative care clinic which runs every first and third Friday of each month, and we usually book for 2 patients. After assessing them and finding out that they are eligible for the palliative care clinic, we have a team which is composed of the oncologist, Dr. Nandi, then the oncology nurses, who are 2, the community home-based care nurses, the dietitian, the social worker, the physiotherapist, the pastor, and the palliative care doctor, MO. And then what we usually do is call the caregivers or the relatives and the patient, and then we try and identify their problems and then solve them. Thank you.
Yeah, good afternoon. I'm Dr. Simanza, Superintendent Sekhoma Memorial Hospital here in Botswana. Now, I've been asked to talk about what I think regards to end-of-life care or palliative care management, especially in our facilities in hospitals around the countries. First and foremost, what I must say to you here is that I've already seen a great change in the way even I perceive this following the oncologist Dr. Nandan, who has been with us here for almost 2 years. What we are seeing now is that patients with chronic disease like cancers, patients with chronic HIV end stage, patients with all kinds of illnesses at their end stage, the care for them has definitely improved. And this is attributed to a better understanding on the use of analgesia, drugs like morphine, which most of the times most doctors, I must say, unfortunately, also fear to use. But we can see, we've already seen a change in that, and we're seeing more doctors now being more confident in using that. And with this kind of thing, you realize that the patients equally now are, don't know if the right word is to say enjoying, but at the end of the day, as their life comes to an end, the pain and suffering that has gone through has reduced. That is why I feel and I agree that the education that we are receiving from some of these trainings that we are being given is important. And that is why, again, remember the last offices most of our patients receive are in our own facilities. Cancer patients, chronic patients, they're all brought in on their last end of stage, and so we should be the ones who should be able to manage them in the hospital facilities. Having said that, it's also equally important that the communities are educated on this, so that the communities and the clinics and the health boards out there are also better able to manage patients. Remember, people should die with dignity.